Good morning, I am Anslin. Now we are going to discuss about blood transfusion. The definition of blood transfusion is a blood transfusion is the infusion of whole blood or blood components such as plasma, RBCs or platelets into the venous system. The purposes of blood transfusion are to increase blood volume after surgery, trauma or hemorrhage, to increase the number of red blood cells in a patient with severe chronic anemia, to provide platelets to patients with low platelet count due to treatment with chemotherapy, to provide clotting factors in plasma for patients with hemophilia or disseminated intravascular coagulopathy, to replace plasma protein such as albumin, to replace fresh frozen plasma in case of DIC. The indications of blood transfusion are hemorrhage, trauma, burns, severe anemia, plasma protein or clotting factor deficiency, leukopenia, pathological conditions which result in decreased blood cells. The contraindications of blood transfusion are decreased cardiac output, active infection, fluid overload, renal failure. The nursing assessment of blood transfusion are assess the patient for the indication of the blood transfusion, verify the physician's order for the type of blood products to be given, review the patient's transfusion history, especially any reactions or pre-transfusion medications to be given, review the baseline vital signs in the patient's medical record in order to compare with vital signs during the transfusion, assess the type, integrity and patency of the venous access, verify the large bore catheter, that is 18 gauge, has been used to prevent hemolysis, review hospital policy and procedure for the administration of blood products. The preparation of equipments are a clean tray containing blood administration set with filter, intravenous solution of 0.9% sodium chloride, disposable gloves, adhesive tapes to secure IV line, kidney basin, medication card as per policy, syringe with distilled water or normal saline or heparin flush to flush in case of block in the line, blood products in the container for transfusion along with the compatibility forms and blood details, IV pole, a sterile tray containing emergency medications, infusion pump if needed, vital signs tray. The nursing procedure: verify the physician's order for the transfusion, explain the procedure to the patient, ensure that the consent forms are signed, inform about the side effects such as dyspnea, chills, headache, chest pain, itching to the patient and ask her to report to the nurse, obtain baseline vital signs, obtain the blood products from the blood bank and ensure that it is initiated within 30 minutes, verify and record the blood products and identify the patient with another nurse, patient name, blood group and RH type, cross-match compatibility. The recording and reporting: record the time, date and time of blood transfusion, mention the details of the transfusion including type of blood, blood group, bag number, starting time, ending time, flow rate and the adverse reaction during the transfusion. Record the vital signs before, during and after the transfusion. The nurse's responsibility during blood transfusion: observe the signs of transfusion reaction, observe the patient and laboratory values to determine response to transfusion, monitor IV site and status of infusion each time when vital signs are taken.